The first 72 hours after a suicide occurs in the community are very critical. Having a plan in place beforehand will provide the most effective response. When a suicide occurs, those who may have witnessed the event or those who responded will most likely be overpowered with strong emotional and physical reactions. To prepare, communities will want to identify a care support team to work with law enforcement to respond quickly, assess safety, and provide support to those who are most impacted. The strongest team will usually be local people plus trained professionals who are often from outside the community. Professional care support team members are often trained in critical incident stress management. Critical incident teams can be brought into the community to provide immediate relief or support during a crisis. To request a critical care team, call your regional healthcare corporation or the local community behavioral health center. You should find a 24 hours a day, 7 days a week number for your local or regional critical incident team ahead of time. You can also refer to the Preparing for the First 72 Hours chapter of the Postvention Guide for referrals and resources in Alaska. Critical incident teams don't usually provide long-term counseling, so it's important to prepare for ongoing community care and support once the initial crisis is over. Also, the closest suicide prevention group may be a good resource. Refer to the Postvention Guide for information on locating a group or creating or joining an existing one. Planning is important. There are many things you can do before a suicide occurs. We'll go over a few things you should and shouldn't do. Actions to take. Assemble a care support team made up of anyone in the community or village who can respond to a suicide crisis. Examples would include health aides, clergy, school counselors, or elders. Include public safety and local first responders to discuss what everyone will do when responding to a suicide crisis, including suicide attempts. Contact local health aides and clinics to see what help the Regional Health Corporation can offer, such as a critical incident stress management team. Talk to children early and often. Explain to them that suicide is due to extreme pain that people feel that makes them not think clearly. They believe that suicide will solve their problems, but we know that death is forever, and most problems and painful feelings are only temporary and will pass, like winter turning into spring. There's also an action you should avoid: silence. Talking about suicide can be difficult, but silence on this matter can be harmful. Talk openly about people's thoughts and feelings about past suicides. Reinforce the idea that suicide is preventable and unacceptable. All of these conversations can be part of the larger healing process and help prevent further suicides. This section is for communities who have lost someone to suicide. Having a plan in place will make the process run more smoothly. First, we'll talk about the actions you should take. Contact the local or regional clinic or health corporation to request a critical incident stress management team, if one is available and part of your plan. Identify others who may be at risk. You should talk to them and ask them directly if they are also thinking about suicide. Keep watch and observe. Have gatekeepers on alert. Gatekeepers are people who are well known in the community and likely to know if someone is depressed and vulnerable, or people who have gone through the gatekeeper training offered in Alaska. You should also identify a safe house for youth. Encourage family and community members to talk, start the grief process, and share with others who have experienced suicide loss. Parents and adults should process their own grief before talking with children. Help arrange funeral services as a private ceremony reserved only for close family members, relatives, and friends. Holding a big ceremony for someone who died by suicide could make the aftermath look worthwhile to someone else who's also thinking about suicide. A vulnerable person might see death as a way to get positive attention, especially if they do not get it in life. Give media the covering suicide guidelines found later in this video and in the Members of the Media chapter in the Postvention Guide. Seek spiritual guidance, clergy, and other cultural practices that honor traditional healing. There are also actions to avoid in the event of a suicide in your community. Public announcements, such as messages on VHF that a suicide has occurred, The news should be shared in private so that people can be comforted based on their reaction to the event. How the death occurred should only be discussed once the facts and details are known. Silence. Although you should avoid public announcements when a suicide occurs, it does not mean that you can't talk about it. It should be talked about, openly, either one-on-one or in small groups to allow for personal sharing of thoughts and feelings. Public or community-wide memorials are discouraged. It's often difficult for others who are experiencing suicidal thoughts to separate the memorial of a person who has died from the act of suicide. They may see the person's choice of suicide as a desirable option. Talking with the media, newspapers, or radio about the details of a suicide is also discouraged. Details can promote suicidal thoughts in someone who is vulnerable. Suicide is generally a response to a very complex situation. To try to sum it up with speculation does disservice to everyone. Do not suggest that suicide is a normal response to a common problem. Suicide is most often due to several factors that are not easily explained. Information released to the media or in public should acknowledge that fact to avoid normalizing the event. Research has shown that we need to talk openly about suicide, but the manner in which we speak of and communicate about suicide is extremely important. Certain things can increase the risk of suicide among others in that village or community, which is counterproductive to the goals of postvention. Talking about suicide requires care and thought. It's important not to make suicide seem normal or appear as an acceptable way to deal with problems or get positive attention, even if that is not the intention of the message. Here are some basic guidelines from the National Suicide Prevention Resource Center to make things better, not worse. Things you should do. Acknowledge that the person was having difficulties so people will understand that suicide doesn't come out of nowhere, but avoid gossip about the causes. All of the reasons behind a suicide might never be known, and no one wants to be hurtful to loved ones left behind. Share feelings with one another, but be careful when and how. Parents and adults should process their own feelings before helping youth talk about how they feel. Someone who is feeling angry should be careful to express those feelings only around someone who's prepared to hear them. Maybe to a pastor or someone who is not as close to the deceased in order to spare the feelings of those who are feeling fragile. Give the care line number found in the first 72 hours chapter of the Postvention Guide to people who are grieving, people looking for ideas on how to support those who are grieving, and to people who are in crisis. For young people who might be more comfortable texting, the care line has text-based help available during much of the week. That number is also in the Postvention Guide, along with contact information for other state and national resources. Share that suicide is preventable. Research has found that 90% of the people who have died by suicide have a medical condition such as depression or substance abuse problems. These are treatable conditions, but be careful not to imply that anyone other than the person who committed the act is responsible for a previous suicide, just because someone was not able to prevent it. You may want to share the warning signs of suicide. Sometimes in the days, weeks, or months after a suicide, other vulnerable community members start feeling suicidal and show some of these signs, which can be very clear or more subtle. A complete list of these signs can be found in the first 72 hours chapter of the Postvention Guide. Talking about wanting to die. Talking about feeling hopeless or having no purpose. Talking about feeling trapped or being in unbearable pain. Talking about being a burden to others. Increasing use of alcohol or drugs. Withdrawing or feeling isolated. Displaying extreme mood swings. Giving away prized possessions. The more of these signs a person shows, the greater the risk. Warning signs are associated with suicide, but may not be what causes a suicide. If someone exhibits these warning signs, it is okay to ask direct questions. Are you thinking of killing yourself? Do you wish you could fall asleep and never wake up? If you feel the person is thinking of ending their life, there are things you can do. Offer them the Postvention Guide. Try not to leave the person alone. Remove guns, knives, and other weapons that could be used in a suicide attempt. Call Careline for suggestions on what else to do. Go with the person to a health professional, if at all possible. There are also things you should not do after a suicide has occurred. Don't glorify people who have died by suicide. Comments and events that seem to celebrate the person and gloss over difficulties the person had can be harmful because vulnerable people, especially young people, may see suicide as a way to get positive attention in the community that they don't get in regular daily life. Don't present suicide as a normal, common event. While significant numbers of people die by suicide and each suicide has a huge impact, the fact remains that most people do not turn to suicide during times of struggle and pain. They find more constructive ways to cope and to carry on. When we talk about suicide, we want that message to come through loud and clear, clearly expressing that suicide is not normal and that there is a community expectation of seeking help and enduring can be a protective barrier against suicide. Don't present suicide as an inexplicable act of an otherwise healthy or high-achieving person or explain it away as stress-related. This might encourage vulnerable people to identify with the person who died. Presenting suicide as an understandable response to a stressful situation may also be harmful. Oversimplifications such as these can mislead people into believing that suicide is a normal response to fairly common life circumstances. Also, giving an overly simple explanation misses the opportunity to inform people about both the complexity and preventability of suicide. Don't give detailed descriptions of suicide victims or how the person died. Research shows that pictures or detailed descriptions of how or where a person died by suicide can be a factor in vulnerable individuals imitating the act. Clinicians believe the danger is even greater if there is a detailed description of the method. If vulnerable individuals can identify with the means and method of how the person took their life, that might lead to them considering ending their lives in the same way. The most effective way to prepare is to have a checklist to be used in the all-critical first 72 hours after a suicide. The list can be found in the Postvention guide in the first 72 hours chapter. This will include important steps, contact information, and other helpful tips that will make this process efficient. Some of the highlights of the checklist include law enforcement contact information, critical incident team and local care support team contact information, people to care for and comfort family, friends, and persons who find the body, designating a media contact and people who can monitor channels for potential at-risk persons, establishing what information will be shared about the death, incorporating the safe message guidelines, setting up chains of communication via social media and by phone communication, creating a contact network to share the news of the suicide with the community and relatives, making sure first responders and law enforcement personnel are attended to on a human level. There are two groups that typically deal with a suicide: law enforcement and the state medical examiner's office. Law enforcement agencies include Alaska State Troopers, village public safety officers, and local city police departments. Officers know that a suicide has an instant and immediate ripple effect in the communities, and they do their best to respond by doing their professional duty to establish the facts of an event. They also support those suffering a loss, both family and friends, and the entire community. The state medical examiner's office is required to independently investigate potential suicide deaths in Alaska, and staff work closely with law enforcement and family members. Law enforcement plays an important role in responding to suicide deaths because they are generally the first to respond to the scene of an unattended death, which is when the cause of a sudden or violent death is not witnessed and the manner of death has yet to be determined. Because unattended deaths are not always immediately identified as a suicide, the law enforcement agency on the scene is often required to conduct a death investigation to rule out the possibility that a crime has been committed. They must follow the agency's death investigation procedures until it can be determined if a suicide has occurred. Law enforcement may be procedurally bound to disclose the cause and manner of death as public record. However, they should be respectful and sensitive to the needs and rights of the families involved. For a complete guide on what to expect from these agencies if a suicide occurs, please refer to the Postvention Guide, the first 72 hours chapter. You can also find helpful contact information for specific agencies in the guide.